Sepsis is one of the leading causes of preventable deaths worldwide, but early recognition can save lives. In this complete nursing guide, you'll understand sepsis from its pathophysiology to bedside management using simple explanations, high-yield NCLEX concepts, and practical clinical tips. If you're a nursing student, staff nurse, or preparing for the NCLEX RN, this video is designed just for you. Let's simplify critical care and become more confident nurses. Let's begin. Sepsis does not start in the blood. It starts with an infection anywhere in the body. It could be a UTI, pneumonia, a wound infection, an Ivline infection, even a dental abscess. The infection itself is not sepsis. Sepsis is what happens when your immune system overreacts to that infection. That overreaction is what destroys the body. When bacteria, viruses, or fungi enter the body, the immune system detects them immediately. It releases chemical messengers called cytokines to signal the immune army to attack. In a healthy response, this is controlled, targeted, proportional. In sepsis, this response loses all control. It becomes a full-body fire alarm that cannot be turned off. Think of your immune system like a military force. Normally, when there is a threat, it sends a small, targeted unit to the infection site. Deal with the enemy. Come home. Done. In sepsis, instead of a targeted unit, your body declares total war. It mobilizes every resource it has. Entire battalions flood the bloodstream. Friendly fire begins. Your own immune system starts attacking your own tissues and organs. That is the core of what makes sepsis so deadly. Nurses, this is a critical concept. Listen carefully. A cytokine storm is when the immune system releases an uncontrolled flood of inflammatory chemicals called cytokines, interleukins, tumor necrosis factor, interferons. These chemicals are supposed to fight infection, but in massive uncontrolled amounts, they cause inflammation everywhere, not just at the infection site, everywhere, simultaneously. This is where sepsis becomes life-threatening. The cytokine storm directly attacks blood vessels. Here is what happens step by step. First, blood vessels dilate massively. They become too wide, too loose. Second, the vessel walls become leaky. Fluid pours out of the bloodstream into the surrounding tissues. Third, blood pressure drops. There is not enough volume in the vessels to maintain adequate pressure. Fourth, tissues stop receiving enough oxygen. Cells begin to die. When blood pressure drops so severely that it cannot be corrected with IV fluids alone, we call this septic shock. Septic shock is sepsis plus persistent low blood pressure plus high lactate levels in the blood, greater than 2 millimoles per liter. This is a medical emergency. Mortality in septic shock can exceed 40%. Every minute of delay in treatment increases the risk of death. When tissues stop receiving oxygen, organs begin to shut down one by one. The kidneys stop filtering waste. Urine output drops. Creatinine rises. The lungs fill with inflammatory fluid. The patient cannot breathe. ARDS develops. The liver loses its ability to clot blood. Bleeding risk skyrockets. The brain becomes confused and delirious. Altered mental status is one of the earliest signs. The heart struggles to pump against collapsing vascular resistance. When two or more organ systems fail simultaneously, this is called MODS, multi-organ dysfunction syndrome. This is the end stage of untreated sepsis. The more organ systems involved, the higher the mortality rate. 2 organs failing, mortality approximately 35%. 3 or more organs failing, mortality can exceed 70%. This is why early recognition saves lives. Nurses, you are the first line of detection. Know these signs: fever above 38.3 Celsius, or hypothermia below 36, heart rate above 90, respiratory rate above 20, altered mental status, confusion, agitation, decreased urine output, skin changes, mottling, pallor, clamminess, elevated lactate. The tricky part, early sepsis can look like just a regular infection. Trust your clinical instinct. If something feels wrong, investigate immediately. You need to know the SIRS criteria. Nurses. Systemic inflammatory response syndrome. 2 or more of the following: temperature above 38 or below 36 Celsius, heart rate above 90 beats per minute, respiratory rate above 20 or PaCO2 below 32, white blood cell count above 12,000 or below 4,000, or more than 10% bands. 2 or more criteria, plus a suspected infection, equals sepsis by older definition. Know this for your NCLEX and your clinical floor. The qSOFA score is the quick bedside tool you can use without any lab work. 3 criteria, 1 point each: altered mental status, GCS below 15, respiratory rate 22 or above, systolic blood pressure 100 or below. A score of 2 or more out of 3 suggests high risk for sepsis. This takes you 30 seconds at the bedside. No labs needed, no equipment needed, just your assessment skills. This is why your nursing assessment matters. When sepsis is identified, the Surviving Sepsis Campaign Hour-1 bundle must be initiated immediately. Within 1 hour, measure lactate level. Blood cultures before antibiotics. Broad-spectrum antibiotics administered. 30 milliliters per kilogram IV crystalloid for hypertension or lactate greater than or equal to 4. Vasopressors if patient remains hypotensive. Nurses, you initiate most of these interventions. You draw the cultures, you start the fluids, you notify the provider. Speed is everything, every minute counts. As the bedside nurse, your priorities in sepsis are: 1. Recognize it early, trust your assessment. 2. Notify the provider immediately, use SBAR, be clear, be urgent. 3. Obtain IV access, 2 large bore IVs. 4. Draw blood cultures, 2 sets, before any antibiotics. 5. Administer antibiotics on time. Every hour of delay increases mortality by 7%. 6. Monitor urine output hourly. Less than 0.5 milliliters per kilogram per hour is a red flag. 7. Reassess continuously. Sepsis can deteriorate within minutes. Outstanding work, nurses. Let's recap. Sepsis begins with infection, but the damage comes from the immune system's own overreaction. Cytokine storm leads to vessel damage, leads to BP drop, leads to organ hypoperfusion, leads to organ failure, leads to death. Recognize it early using SIRS and qSOFA. Act fast using the Hour-1 bundle. Your nursing assessment saves lives. You now understand what happens inside the body during sepsis, better than most nurses on the floor. You've just completed this comprehensive lesson on sepsis. Today, we covered the complete pathophysiology of sepsis, understood the cytokine storm, learned the SIRS and qSOFA criteria, reviewed the Hour-1 sepsis bundle, and discussed the most important nursing priorities for safe and effective patient care. Remember, recognizing sepsis early and acting quickly can save lives. As a nurse, your assessment, clinical judgment, and timely interventions make a real difference. If you found this lesson helpful, save this video so you can revisit it during your NCLEX or nursing exam preparation. Don't forget to like this video, subscribe to the channel, and leave your questions in the comments. I'll be happy to answer them and create more videos based on your requests. Thank you for learning with RN Coach Sunil.